Good evening to all. Today we are going to discuss a new topic, that is calcium. In the last class we discussed about sodium, and today we are going to discuss about calcium. The calcium normal range is 4.3 to 5.3 milliequiliters or 8.5 to 10.5 mg per deciliter. So the most common macro mineral found in bones, that is our calcium. Calcium salts with the phosphate, carbonate and fluoride in bones and teeth to harden them. Tooth enamel is comprised of mineral calcium phosphate arranged in a crystal structure. We used to call it as that structure as hydroxyapatite. So the calcium is required for functioning of nerves, muscles, blood clotting, acting as a cofactor and in formation of prothrombin activator and thrombin. Hypocalcemia. We'll observe two conditions when the calcium level increase or decrease. When the serum calcium level decreases its concentration less than 8.5 mg per deciliter, then we used to call it as hypocalcemia. Causes for hypocalcemia is when the calcium level excretion is increased, absorption is inhibited from the GI tract, prolonged immobility, vitamin D deficiency, hyperphosphatemia. See, when the condition calcium will increases, its opposite, for phosphate will decrease. When the phosphate will increase, calcium will decrease. They both are indirectly connected with each other. And hypomagnesemia also. Tumor lysis syndrome, massive blood transfusion. In massive blood transfusion, citrate toxicity will be there, that may lead again hypocalcemia. Sign and symptoms of hypocalcemia. So when the patient suffers with hypocalcemia, initial sign and symptoms will be numbness, tingling of fingers and toes, tetany, increased muscle tone, spasm of laryngeal muscles, trouser sign, carpopedal spasm. When we'll cuff the PP cuff to the arm of a patient, when we'll increase above the cuff pressure of 60, systolic pressure above 30 mm of SG, then that may lead a trouser sign. Chvostek sign means here the facial, when we tap the facial nerve or face of the patient, we'll observe the twitching of facial nerve. And diarrhea due to increased motility of gut. Along with this, we can observe the changes in ECG, that is prolonged ST segment and QT interval elevation. So medical management will provide or will administer calcium gluconate 10% injection IV over almost in 10 minutes we used to go. Here we need to extend, means slow IV is a safety. Administer aluminum hydroxide, and this will also help in calcium increase in the blood level. So vitamin D supplementation, because that increases absorption of calcium in the intestine. So nursing management here, monitoring serum calcium level, IV site infiltration, because whenever we'll provide calcium gluconate or potassium through the blood vessels, that may get chances of necrosis, spasm and all. To prevent that, we have to give it in a slow and in a diluted form. And along with that, we need to monitor cardiac rhythms, assess for tetany like symptoms and assess for Chvostek sign. Along with rapid calcium gluconate IV push administration may lead rapid drop of BP, arrhythmias and cardiac arrest. Taking seizure precautions when hypocalcemia is severe. Monitoring conditions of airway, because laryngeal spasm will be there because of deficiency of calcium. Taking safety precautions if confusion is present. Thank you.